Hey everybody, Dr. Rob here. Hope you had a great weekend. I've got a great topic today, something that's very personal to me, something that I talk about with all my patients. It's called food sensitivities. And a lot of people don't realize what a food sensitivity is, and many people are going to ask the difference between a food allergy, a food intolerance, and a food sensitivity. A food sensitivity I have found to be a critical element to remove as a trigger for inflammation, or what I like to call the intersection of inflammation, gut permeability, and immunity. I think it's a hidden attack by food. Food can be a potentiator for inflammation. Good food, can be a potentiator for inflammation. So let's really talk and explore the idea of what food sensitivities do and what they can do to you and how deleterious they can become. First off, let's define the difference between a food allergy, food intolerance, and a food sensitivity. A food allergy is something that we define as an IgA-mediated type 1 hypersensitivity. What does that mean? Do you ever get stung by a bee? So if you get stung by a bee, everybody always says anaphylactic. Yeah, that is a type 1 where you have trouble breathing, you may need an injection and all that. But you can get stung by a bee and swell. You have an immediate reaction to the ingestion or the insertion of that particular venom. Same thing with the food. Have you ever eaten a food and very quickly swelled, got a rash, got some gastrointestinal difficulty like eating gluten and immediately need to go to the bathroom and getting diarrhea? That's a food allergy. We save that for the food allergies. We save that for the allergists. It's obvious. Everybody knows it. A food intolerance is interesting in that it's a non-immunological reaction to a food. Kind of like a lactose intolerance is a great example. So that's very different than a food allergy. Also very different, and what I test for a lot in my office, is food sensitivity. That is an actual immunological reaction to food. It's an IgA, or most commonly an IgG-mediated delayed hypersensitivity. So when we talk about IgE, IgA, and IgG, there's some things that we need to go and discuss. IgE, these are the immunoglobulins. They're part of your adaptive immune system. They're actually part of what we call your B cells. So having said that, IgE again is an immediate. IgA is something that is early but is not immediate. Now IgG takes some period of time or duration of time. So IgG is a critical element. You want to test that immunoglobulin. You want to see how the body responds. One real caveat when it comes to a food sensitivity that everybody should know is that food sensitivity can take symptomology or a delayed symptomology up to 72 hours. So in theory, and I'll say this a few times, you can eat and 3 days later you'll have the symptoms, and that poses the issue. That's why most patients don't know that they have food sensitivities. So let's do an overview of food sensitivities in America today. They're related to at least, not just in America, but actually 100 million people worldwide. The prevalence of food sensitivities is 50% in adults, and growing in the last few years, and 70% in children. So 1 in 2 Americans that test for it, or adults, actually have a food sensitivity. The symptoms vary from skin rash, headaches, to intestinal disorders. 90% of the food sensitivities are limited to these 8 food groups. They are milk, soy, eggs, wheat, peanuts, tree nuts, fish, and shellfish. So one or all the foods in a specific group may cause a food sensitivity. Once again, they're usually delayed up to 72 hours after consumption. Now, the food sensitivities are caused by what we call an IgG 1 through 4. And that's a big component. And they call it IgG 1 through 4 and immune complexes that can activate something called complement. I'm going to go through all that. IgG, there's 4 IgGs, 1 through 4. Most food sensitivity tests only test IgG 1 and 2. The one that I use, KBMO, tests IgG 1 through 4. And when we talk about the immune complexes that activate the complement, the complementary immune system come from the innate immune system. So the test is really testing your response in your innate and your adaptive, the 2 arms to your immune system. So I see somebody who said no peanut butter then. No peanut butter. Peanuts or peanut butter is a very high allergy food, one that should be avoided at all costs. So I'm not a big proponent of recommending peanuts. I usually take them out as an inflammatory food. So what should providers look for? What should patients or what are symptomologies that patients should have that they may want to come to the doctor and get a food sensitivity test? Well, if you just don't feel well, it's not a bad idea. If you have an autoimmune disease, that's a big beeping red light to go get a food sensitivity test. If you have a thyroid problem, great idea to get a food sensitivity test. If you have arthritis, whether it be rheumatoid arthritis, obviously autoimmune, or osteoarthritis, which is also autoimmune. If you have gastrointestinal discomfort, if you have brain fog, if you have fatigue, most patients complain about fatigue, really should look to see if they've got a food sensitivity. If you have, once again, any digestion, any gut problems, any skin problems, definitely get a food sensitivity test. And let's not forget, if you as a patient, a female, has fibroids, endometriosis, any women issues, a lot of that can be attributed to a food sensitivity. So the real question is, for me, if I can just explain the immune complex issues and the inflammation that can be associated with foods or food sensitivity, is truly many of the underlying problems I see every day in my office, whether it be musculoskeletal, whether it be functional medicine or functional nutrition. So without question, I'm all about getting to what we call root cause resolution, looking at the systems and not the symptoms. One of the best root cause resolutions are triggers. Foods are triggers, and food sensitivity is a large trigger also. So people have asked, give me a list. Which are the foods that most people are sensitive for? So let me give you what I found, and this list is always fluid. It's changing as we go. Here's the top 20 foods in no order. Please make note. Almonds, bananas, beef, brewer's yeast, candida, casein, chicken, corn, cow's milk, egg white, egg yolk, gluten, no surprise there, right? Peanuts, like we said before, pineapple, salmon, shrimp, lots of shellfish actually, soybean, tomato, white potato, whole wheat. So again, these are the top 20. I may share a list. It may change a little bit. It's like rankings, but I can tell you that top 8, which I mentioned before, is always going to be the top 8. So what I like about the FIT test, so I'm now going to introduce the FIT test. That's what I use in my office, the food inflammation test from KBMO. Gives me a great patient report. In that patient report, it shows me foods to eat and foods to avoid. The foods to avoid are rated on the reaction scale from 4, very high reaction, 3, not as high, 2, quite mild, and 1, not that much. I still take the ones out. I know you can add them all up. They have an equation. Anything that anybody responds to, I remove for a period of time. So let me make this crystal clear. Just because you have a food sensitivity does not mean you have to remove the food for perpetuity. You remove the food for a period of time and then go through what I call my 7R program, or whoever you're seeing, every doctor, fix the issue or the damage, if you will, and then you can reintroduce the food or you can retest the food. For me, almost up to 70% of the foods that people were sensitive for after going through my program, they've been able to add in. So you're really not going to lose the food. It's just a short period of time. I want to make that clear. You're not losing the foods forever. You're just removing them for a period of time until you fix the damage that some of the sensitivities can cause. Now, some of the interesting things about food sensitivity, and the big question is, did the food sensitivity damage the gut lining, or did the gut lining damage the food sensitivity? We're really not sure. Food sensitivities can damage gut lining. You can have food sensitivities if you've got what we call leaky gut. Anyway, so to get back to the report, it's a color coordinated report that I can share with the patient, and it can look at the colors because we have different colors of red, yellow, green, lime, and no color at all for things that don't light you up. In addition to that, we test for additives. And here's where I really like the bang for the buck. When you look at these additives, and a lot of these additives are like MSG, BHA, benzoic acid, polysorbate 80, red 3, red 40, yellow 6. These are all things that are preservatives. So like a red 3 is when you lick a lollipop and you see your tongue go red. obviously not good. Many of these additives that they're testing for, I don't want you to take anyway, because the additives you're always going to respond negatively to. Why would you want them in your system anyway? They are toxic. Some of the additives that they test for are aspartame and saccharin, artificial sweeteners. They really have a special proverbial place in my purgatory, if you will. And they have a special place because these artificial sweeteners are extremely deleterious to your overall health. These artificial sweeteners fake the brain into thinking carbohydrates are being consumed, and then you release insulin. So even though you don't have any calories, you're still getting the release of insulin. And when you couple that with the fact that it can cause neurodegeneration, that poses an issue that I don't want any artificial sweeteners. The only artificial sweeteners that I consider in any of my supplements or to add in my coffee, because I like my coffee sweet, is stevia and, of course, monk fruit. These other ones are no buenos. In addition, if I can add to that, they've shown to damage the gut microbiota and actually damage what we call the tight junctions, which we're going to get to in a little more when we talk about the Zonulin test. One other thing, I just want to make a point of this. I'm going to stop for a second and just let everybody know that consumption of artificial sweeteners increase the incidence of dementia and stroke by 2 to 3 times. So get rid of those colorful artificial sweeteners. They're tested to see if you react. I'm telling you, I like to remove all additives. And so why do we really care at a high level of chemical additives? Gut health is determined by an intact epithelial barrier and a balanced gut microbiota. We want our gut epithelial to be in perfect, pristine condition. It should be semi-permeable, kind of like a cheesecloth. Very few things pass that cheesecloth. But if you make the cheesecloth too big, things pass that shouldn't pass. The gut microbiota are bacteria. You've heard me talk about this a multitude of times. So when we talk about the gut microbiota, we're talking about having bacteria, not only the right kind of bacteria, but the ratio of the good versus the bad bacteria. It's 85% or more of good bacteria versus bad bacteria. That 85%, as long as we're above it, allows us to avoid something called dysbiosis. Dysbiosis is that unleveling of good and bad bacteria. That's a critical element because what goes on in our gut communicates with everything outside our gut. Our gut is the epicenter of our communication. Our gut is the epicenter of our immune system. 80% of our immune cells are in our gut, and on and on and on. Studies suggest that some direct food additives, but also food contaminants like pesticides, residues, and substances migrating from food contact materials may adversely affect the gut barrier or gut microbiota. One of the pesticides, or the things I really like to refer to, you've heard me talk about it, is glyphosate. Glyphosate is in Roundup. It's used in the soil. World Health Organization has called glyphosate a cancer-causing product. Glyphosate is used as a drying agent on gluten. So no pesticides. Let's get to the idea of zonulin. Zonulin is a protein that expresses itself or elevates when you get open tight junctions. So here is your gut in perfectly pristine condition. When it goes like this, it becomes too permeable. The tight junctions actually can tear apart and open up the gate, if you will. So when zonulin is elevated, it implies that we've got a leaky gut. What things can elevate the release of increased zonulin? Gliadin, which is a protein from gluten, and poor intestinal bacteria. They are the main triggers for zonulin releases. The higher the amount of zonulin, the more we know that tight junctions open up. I like to test for zonulin. Zonulin may open up during the day. Its elevations may vary, but the fact is that if zonulin is elevated for a duration of time, we know that we have leaky gut. So the Zonulin test is very interesting in that it really will enable you to know and ascertain gut permeability. So just to put together the FIT test, the food inflammation test, it tests for food sensitivities all through the IgG immunoglobulin levels, IgG 1 through 4. It also tests for what we call C3d complement, which is your innate immune system, checking both arms. And now when you add zonulin in the next couple of months, it's also through its multi-pathways going to test for leaky gut. So you're getting much more than just a food sensitivity test. So a little overview of zonulin. It's a protein that is synthesized in the intestinal and liver cells. It is the critical key biomarker for intestinal permeability, i.e. leaky gut. Interesting, please make note, it's only reversible regulator of intestinal permeability, and elevated levels of zonulin are associated with autoimmune disease, adult glucose intolerance, celiac disease, inflammatory bowel, non-celiac gluten sensitivity, asthma, rheumatoid arthritis, multiple sclerosis, type 1 diabetes, and non-alcoholic fatty liver disease. So there's a plethora of conditions that can be attributed to zonulin, getting back to what we always talk about. All health begins in the gut. There were some studies done with the FIT test, interestingly enough, which again, the food inflammation test. The test showed in a graphic representation, I can share this with everybody, the test before the elimination diet showed very high elevation. So before you took the foods out, you saw a high amount of IgG and CD3 test initial results. The data was analyzed for 30 patients tested before and after the elimination diet. There was a significant reduction in the number of sensitivities reported after the elimination diet, indicating the FIT test could predict specific food sensitivities. And that's a huge takeaway. Then when you couple it with the significant improvement in symptoms observed after the elimination diet, literally going and only having maybe 5% reporting of the patients in the studies reporting of like memory and concentration loss, anxiety, fatigue, sleepiness, etc. The change in the symptomology was robust. Actually, the outcomes were truly stellar. Having shared that with everybody, understanding that symptoms are a sign that something's wrong in the systems, the FIT test can specify what you need to remove. Let's talk a little bit about irritable bowel. I had somebody ask a question about that. Almost about 20% of North Americans have an irritable bowel syndrome. Also estimated with irritable bowel, 25% seek medical care for the symptoms. 5 are seen in what we call a tertiary care center. Although it appears that the percentage of patients seeking medical care for IBS symptoms represents a small percentage of those with IBS, a high prevalence of this disorder results in a sizable direct cost to the patient for physician copays, emergency room visits, diagnostic tests, and pharmacological treatments. So the results in this study were interesting. They tested IBS severity from day 1 to the end of the study. And they had an intervention group and a control group. Now, obviously, the intervention group, they did intervention. They removed the foods. The control group, they didn't. It's a 3-to-1 decrease in severity of symptomology in IBS when you removed the foods. Homocysteine, which is a stroke marker, it was a prodigious change between the intervention group and the control group. So much so, the intervention group had a decrease in homocysteine. The control group had an increase, made it more susceptible to strokes, etc. C-reactive protein also was studied, and the intervention group was a 5-to-1 increase to the decrease of that blood marker, which is a tissue inflammation. So the bottom line is the results were very telling in that 10% reduction in human stays and visits in the intervention group, but a 50% decrease in PCP visits in specialist office in the intervention groups. So many people ask me, they say, do I have to go to the doctor? I have no problem with going to the medical doctor. I'm a big proponent of the medical doctor. Nobody's better trained than the medical doctor. The question is, are they trained in this? And with this food sensitivity and this functional medicine chiropractic background, how well suited am I to help you? I believe we're very, very well suited. So let's talk about the products that I have in my office. Anybody have any interest, any questions, feel free to reach out. Once again, it's KBMO. Good friend of mine, James White, is the CEO. A lot of the tests were created by Dr. Brent Darville. So let's go through the products. They have what they call the new FIT 132 test. I use it in my office because they've switched out some of the food sensitivity. So food inflammation tolerance, essentially they're testing for 132. They also have now the FIT 176, so they've added 44 new foods. So the list is growing, and believe it or not, people are finding themselves to have more and more sensitivities. The zonulin component is coming in the next month or two. So that'll be put in with the Fit 176. Going to have tremendous outcomes. And I'm looking forward to the what we call the FAST test. The FAST test is going to be in the office. I'll be able to shake it up. I'll be able to tell you lickety split if you're allergic, if you have a food sensitivity to gluten, eggs, and dairy right away. So everybody who doesn't want to get their blood drawn, it's a finger stick, it's going to be a true breakthrough. So let me go to the questions now. I try to keep it at 20 minutes. I think we're almost exactly at 20. And let's take a look at what we have here. We talked about the peanut butter. We've got somebody, hey, thank you very, very much. It's been my pleasure to share this information. We don't talk enough about food sensitivities. Yes, you can definitely share this. I implore you to share, comment, and like it. I know it's Monday. Sometimes everybody can't check in. They watch it later. I implore you to share this with everybody. Let's see. We've got amen. Thank you. Too many people don't look at the simple food that they're eating first. That is causing their ailments and illnesses. We need to educate ourselves about food first. It's always food first. We talk about lifestyle. Food is a great component of lifestyle. So the foods that you choose are your information. They're your fuel. If you had a race car, and I like to consider my body a race car, I want to keep it in the most pristine condition. Fixing your hair, fixing your skin is important. That's your paint job. But your gut and your overall health, that's your engine. That's your engine for health. What fuel do you put in? The fuel you put in is going to depict how well you run. The filter that you have for the oil, that's your liver detox. And if you don't put in good fuel, you're going to get too many toxins to that liver filter detox and overwrought yourself. So food is the potentiator for good health. Let's never forget that. Everything's based on that. Remember, Hippocrates once said, all health begins in the gut. Do you have the guts to be healthy? What have you done for your gut lately? Food sensitivities are a critical element to damage your gut. Once again, understand that if you have a food sensitivity, it's vastly different than a food intolerance. It's different than a food allergy. If you take the foods out, you don't necessarily have to take them out for life. You take them out for a period of time till you heal, and then you retest. You can retest with the FIT test, or you can retest through a reintroduction. Also, as a practitioner, I also like to share the idea of I like a baseline and I like to remove what I call triggers. Food sensitivities are a great baseline because they can show you that what we do works. Removing the trigger, whether the trigger is just a food sensitivity, an additive, or any kind of chemical, will lead you down a health promoting path. So again, if you have any questions after this, feel free to write them out. We're on a few times a week. It's been my pleasure. Hope to hear from you soon. Remember, like it, comment, share it. Dr. Rob, always yours in health.